It's a big difference in helping improve the lives of children with sickle cell disease and other life-threatening conditions. It literally saves lives.
Which is why the Blood Donor Center here at Children's Hospital Los Angeles is so important. On average, every year, 1,800 young patients at Children's Hospital Los Angeles require 19,000 units of blood to survive.
They go through numerous surgeries every week where one patient could use up to about 3 or 4 units of blood, and that's just one surgery. And we could have maybe about 20 to 30 in a week, every week.
But the demand for blood, vital to the health of these children, still outweighs the supply.
The shortages itself is because also we have bone marrow transplant patients, patients with leukemia that are also needing blood, or trauma that came in from the outside of the hospital. They use blood too, so it's a constant need. It's ongoing, so it's kind of like a glass with a hole at the bottom. It's hard to keep full.
George Merida's job is to try to keep that glass as full as possible. As the blood donor recruiter at the hospital's Blood Donor Center, he urges people to donate.
We can get every person that we have so far to come in every 2 months, and we wouldn't have a shortage. It's just one little poke, and with that one little poke, they can save up to 3 lives at a time.
If there's anyone who knows firsthand how blood donation can save lives, it's Jackie Moran. Her 9-year-old son, Rowan, was recently diagnosed with a life-threatening disease and underwent a bone marrow transplant.
My son was diagnosed with aplastic anemia. It's a very critical condition that his immune system is attacking his bone marrow. He makes no blood. It's sudden onset. I had a healthy child 6 weeks ago, never had a problem, and within a week of the onset of this condition, we wound up here at Children's Hospital.
Jackie's friend Lisa stepped in to donate platelets for Rowan. Platelets are blood cells that help control bleeding. When I found out that I could directly know where my platelets were going, then I came here.
My son has used blood on a daily basis. He actually had a brain hemorrhage. If not for a place like this that had platelets available within 20 minutes, he would not be here today.
A few seconds for a nice cause. I think everybody could handle a needle prick to make a big difference in somebody's life.
I know that the kids that are in need of it are going to get the blood that they need. I personally have seen families here whose kids have survived and kept going, or have gotten out of this hospital because of people's donations of blood. And if it wasn't there at the time that they needed it, the outcome could have been much worse. So it's just a satisfaction of seeing where the blood's actually doing, which is saving lives. That for me is the biggest reward.
According to the American Association of Blood Banks and the American Red Cross, although 50% of the American population can donate blood, only 3% in California do. The low number of donors means that Latino and African American children suffering from conditions like sickle cell disease are put at even higher risk.
Because donors from the same